I decided to do my presentation on physical and psychological effects on intersex individuals. An intersex individual may have reproductive anatomy that doesn't seem to fit the typical definition of female or male. An example of this might be a person born with female external genitalia but may have male internal sex organs. The frequency or likelihood of a child being intersex is very hard to determine. Sometimes the individuals aren't diagnosed till puberty, and many people disagree on what is considered an intersex baby. So there are many different statistics. Some believe that around 1.7% of babies are different from what are considered boy and girl. Others have said that 1 in 20,000 children born are intersexed. Fausto Sterling, an anthropologist, believes there are 5 or more sexes. He thinks the term intersex is a catch-all for the 3 major subgroups with some mixture of male and female characteristics. He believes there are males, merms, herms, firms, and females. Male is someone with male internal and external genitalia, and a merm is an individual who has testes but has female external genitalia but no ovaries. A herm, or a hermaphrodite, which is what people used to call intersex individuals, is an individual who possesses 1 testy and 1 ovary. A firm is an individual who has ovaries but has some aspect of the male external genitalia but also lacks testes. And then a female is someone who has female internal and external genitalia. Societal norms are the main reason why intersex surgery is performed, due to the gender binary. In society, we are taught from a young age that there are 2 sexes, male and female. American society revolves around the gender binary, whether it be for jobs, who's in power, and what color is assigned to each gender. By performing corrective surgery, the child's body then fits the societal expectations of sex. More importantly, they fit all the other gender stereotypes associated with sex. Androgen insensitivity syndrome is a genetic condition. It occurs in approximately 1 in 20,000 individuals. With this condition, the body's cells aren't able to respond to androgen, which is the male hormone. In an AIS infant, they are usually born with normal female genitalia with undescended or partially descended testes. The vagina is usually short without a cervix, although these individuals can sometimes have a nearly absent vagina. An AIS individual is considered a woman. The testes are stimulated by the pituitary gland. Physicians often perform surgery to remove the testes and perform a vaginoplasty surgery to increase the size of the vagina. Aphalia is when an individual is born without a penis but has everything else male. Clitoromegaly is when the clitoris is larger than expected and almost resembles a penis. Congenital adrenal hyperplasia is when there is an overproduction of hormones in the adrenal gland, causing masculinization of the genitals in female infants. With this condition, they are more likely to become tomboys than girls without this intersex condition. Klinefelter syndrome is when a male inherits 2 X chromosomes, so their karyotype is XXY. This results in smaller, firmer testicles and infertile sperm. During puberty, many may not develop body hair and may experience breast development. Although most grow up to be men, some develop atypical gender identities. MRKH, or Mullerian agenesis, is when the ovaries are present but the uterus is absent or misshapen. This can be associated with kidney and spine abnormalities. Ovotestes are gonads that contain both ovarian and testicular tissue. A person can be born with 2 ovotestes or can be born with 1 ovary and 1 ovoteste. Genitals can become male, female, or in between. Ovotestes should be monitored because they have an increased risk of gonadal cancer. Sawyer syndrome is when there is an X and Y gonadal dysgenesis. With this syndrome, a person is born without functional gonads, and they are considered gonadal streaks. A child born with Sawyer's looks like a typical female, but will not develop any of the secondary sex traits without the aid of hormone therapy, due to inactive gonads. Turner syndrome is when an individual only has 1 X chromosome. In people with Turner syndrome, female sex characteristics are usually present, but never develop. Individuals with Turner syndromes have usually short stature, lymphedema, which is swelling of the hands and feet, broad chest, and widely spaced nipples. They also might have low hairline, low set ears, and infertility. Congenital adrenal hyperplasia happens equally between XX and XY individuals. This can cause a medical emergency. They have problems with making their own cortisone, a hormone that helps the body respond to stress like heat, cool temperatures, broken bones, trauma, etc. They also have problems controlling their salt levels and is referred to as salt wasting. This condition can cause sickness and even death at times. Gonadal tumors are more likely when Y genes or Y chromosomes are being expressed. This can be treated by removing the gonads, but it's advised to get your gonads removed once there's signs of tumors. Osteoporosis occurs when an individual is born without functioning gonads or if they were removed at a young age. Without gonads, the individual will not produce hormones that will maintain their bones. This may result in brittle bones. One way to avoid this is to go on hormone therapy. If the parents agree that they will allow the child to go through intersex surgery, doctors perform various tests to determine which sex will fit the infant the best. They use phallometers, which measure the length of the clitoris or penis to determine if it should be a girl or a boy. They also do tests with karyotypes. They also take into account good bowel and bladder function, as well as preserving genital sensation and hoping the child will be happy with its assigned sex. There is a lot of secrecy around the surgeries involving intersex children. Many parents feel pressured to allow surgery on their newborn children from the doctors, as well as many children who do go through intersex surgery are used as teaching devices in teaching hospitals. With surgery, doctors operate on gonads, internal sex organs, and external genitals, and is usually performed on newborns. Most of these surgeries, if not all, are irreversible, and a majority of the time they are very unnecessary. With intersex surgery, this can cause a lot of negative effects, like scarring, lack of sensation, trauma, scarring that will limit future surgeries, and much more. Research has shown there is no evidence that surgery delivers promise of making life easier, and in fact, it may inflict shame and self-consciousness. Surgery can also result in decreased sexual drive and function, as well as increased substance use disorder and suicide. Many intersex individuals have come forward and said that their medical intervention was traumatic to their mental health. I believe that in the future we should stop performing unnecessary genital surgery to enforce the norm of male and female.